Hello, I'm here to present the Post-Bac Medical Program at Kaohsiung Medical University. This is a program designed specifically for students who already hold a bachelor's degree and are ready to pursue medicine with maturity, purpose, and commitment. Here is an overview of our program's curriculum. It's broadly broken down into two sections. The first 2 years being preclinical years spent mostly at the university, while year 3 and 4 are clinical years spent doing clerkship at the hospital. Now let's take a closer look at the courses being offered in a chronological order. Starting off with the preclinical courses, we have basic sciences, including biochemistry and anatomy. Anatomy courses also include cadaver dissection. Shown here is our new cadaver lab that was just recently opened in 2024. A long-held tradition includes a anatomy donor appreciation ceremony that honors the individuals who generously donate their bodies to medical education, whom we respectfully call our silent teachers. Through this ceremony, students express gratitude to the donors and their families, reinforcing the values of respect, humility, and compassionate care at the very beginning of their medical journey. The rest of the preclinical curriculum is taught with an organ-based approach. This integrates anatomy, physiology, pathology, and pharmacology into one cohesive framework. This helps students understand how different disciplines connect in real patient care, strengthens clinical reasoning, and makes learning more clinically relevant and easier to retain. And as KMU moves towards internationalization, these courses will be taught bilingually, with handout and source materials all in English. Furthermore, throughout the year, the university invites scholars from institutions such as Harvard University and the University of Hong Kong to lecture topics that can be incorporated into the curriculum. These courseworks are further supported through team-based learning, TBL, and problem-based learning, PBL. These weekly workshops are done through small group discussions of real clinical cases, teaching students to think critically and engage in clinical collaboration. Shown here is a typical PBL setting. As mentioned, students will work in small groups over multiple sessions to analyze a case, from chief complaint and physical exam to labs, differential diagnosis, and management. Then in a future session, they will return to present their findings, developing both clinical reasoning and presentation skills. This approach not only encourages students to be proactive and engaged, but also help them grow into open-minded and independent thinkers. There are also preclinical shadowing opportunities after each organ system module, allowing students to spend a few days in the hospital observing bedside care and understanding each specialty's clinical roles. At the end of 2 years of preclinical courses is the first step in the national board exam, which our program boasts a passing rate of over 90% every year. Then starting in the third year, students begin their rotations at the hospital, going through various specialties at KMU and its affiliated hospitals in the city of Kaohsiung. For the second year of clerkship, students have the options of an elective rotation at external hospitals. This also includes international exchange programs and clinical training at renowned medical universities such as Harvard, Seoul University, and Kyoto University, etc. These experiences broaden students' perspectives and prepare them to become outstanding physicians who care deeply for their communities while engaging with the global medical community. The university also sponsors licensing workshops. For instance, the ACLS certification is a weekend-long workshop held during the second year of clerkship, preparing students with essential life-saving skills required for residency. At the end of clerkship year 2, students must pass the Objective Structured Clinical Exam, the OSCE exam, which rigorously assess their clinical skills, communication, and patient management abilities in standardized scenarios. They also take step 2 of the National Medical Board exam, ensuring they meet the required competency standards to progress towards independent medical practice beyond medical school. If you're ready to challenge yourselves, expand your horizons, and commit to becoming a doctor who serves both local communities and the global healthcare system, this is a program designed for you. We're not just training doctors, we're shaping future leaders in medicine. Please feel us to contact us if you have any questions. Thank you so much.